It's time to sit back, relax, and listen to Change Your Attitude, Change Your Life. Change Your Attitude, Change Your Life will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. Change your attitude, change your life. And now, here's your host, Joan Herman.
Welcome to Change Your Attitude, Change Your Life. You're listening to us in your neighborhood from coast to coast and around the world. Thanks for tuning in. I'm Joan Herman, author, speaker, and your host. Change Your Attitude, Change Your Life brings you interviews with some of the most inspirational and influential people in the world. It's our goal to educate and empower you so you can live your best life now. Thank you for taking time for yourself, and thank you for letting us be a part of your life. We have another great show for you today. Joining me is Debra Jay, a nationally recognized author and addiction expert who is here to discuss a new approach to helping families in recovery. Debra is an addiction counselor and interventionist whose newest book is It Takes a Family, a Cooperative Approach to Lasting Sobriety. Welcome, Debra. Thank you so much for joining us today.
Thank you, Joan. It's so nice to be with you.
Debra, I want to begin our conversation by defining addiction. So many of us have an idea of what we believe addiction is, and I think that often what we believe may be inaccurate. So what is addiction? What does it look like? And what happens to the addict?
You know, this is such a good question. Sometimes we just skip over it, but it's so important because families are confused. What is it? Are they addicted? Are they not addicted? And, as professionals, we do pretty complex assessments, but as families, there are some pretty simple questions you can ask yourself. One being, does alcohol or other drugs cause problems in any area of my loved one's life, repeated problems, and they continue to drink or drug anyway? And if they can answer yes to that question, probably they're looking at addiction. And they probably need to start looking for more information. What do we need to do? What's the next step? And I want to say another thing about it, because sometimes, like, you can have somebody who's a really hard drinker who's not an alcoholic, for instance. So we'll hear people sometimes say, oh, yes, I used to drink a tremendous amount of alcohol. One day I just changed my mind and I stopped drinking, and that was it. And people think sometimes, oh, it's that easy for an alcoholic. But you know what? A hard drinker can do what an alcoholic can't do. And there's a little rule of thumb around that, too. When somebody who is an alcoholic stops drinking, their life gets better. They feel better. And they're like a lot better to be around. But when an alcoholic stops drinking, their life becomes worse. They become more irritable. They become restless. Family members say, wow, it's hard to live with him. He is unhappy all the time. And that, again, is an indication of a problem. And if I can add just one more, sometimes families, they look at alcoholics' attempt to control, because we know, especially earlier on, they're very good at controlling. I'm not going to drink, and they don't drink for a month or 6 months or a week or whatever it is. And the family thinks this is evidence that they can control their drinking. But that thinking is backwards. As professionals, what we look at is, can they maintain that consistently? So when they fall off the wagon, we realize as much as they're trying and as much as they mean it when they promise they're not going to drink, they cannot consistently keep that promise.
Debra, what is a family member to do when you know that there's a problem, you see that the person has a problem, but the person that is addicted doesn't see it? That person is still in denial. What can you do at that point?
Well, and that's what confounds families. In fact, families feel like we're just powerless. There's nothing we can do. And as a society, we tell them that, don't we? I mean, I think one of the most destructive myths we have is you can't help an alcoholic or an addict until he or she wants help. And that seems to make sense. But it's the most pervasive myth. And what it says to families is there's nothing you or I or anybody else can do about this, and you just have to step back and let addiction run through your family like a freight train. You have to let them hit bottom. What nobody tells the family is you're going to hit bottom right along with your beloved alcoholic or addict. And this includes the smallest children. It's simply not all right. So the first thing for families is to change that myth around and say instead, if an alcoholic or addict won't accept help until he wants help, what will get him to want help? What will get him to want help? That question opens doors for family members, and it says there are things that we can do that can change the trajectory of not only our loved one but our entire family. And one of the most powerful things a family can do is a very dignified, loving, well-planned out, structured family intervention. We know today that this is tremendously effective. And Joan, I'm telling you, when it is done properly, and that's very important, when it is done properly, 85% of the people that are intervened on go to treatment that day. Of the other 15%, most of them eventually will go into treatment. It's only a small percentage that don't. And families believe the opposite. They'll always say, oh, listen, our family member will never say yes. And they're astonished when they do. Because families, when they're well-trained, are incredibly powerful, no matter how much the addict acts out, how much they seem, hateful towards you, the arguments, the anger. Underneath all of that, you are just looking at the symptoms of this disease of addiction. Underneath that, addicts, for the most part, they love their families and they want to be part of it. It's that the addiction is tearing them away.
Well, I'm glad that you just mentioned the word disease, because I think oftentimes a lot of people think that an addict is just a weak person or someone who's choosing to do this. So what does an addict look like? Who becomes an addict, and is anyone immune?
Listen, this is the most democratic disease there is. It doesn't matter what your economic background is. It doesn't matter your education. It's definitely not. Sometimes poor parents, they get just beat up, like somehow the parents did something wrong. No, the parents did not do anything wrong. What we understand today, and this is not a new understanding, I'll tell you, Joan, if you go back all the way to the Roman days, they talk about alcoholism as a disease. They understood that back then. Science has been able to catch up to say, you know what, some of us, approximately 1 out of 10, so it's not uncommon, we are genetically wired differently. We have multiple what they call gene variants, that set us up to be very susceptible for addiction, not only to alcohol but to other drugs. We have other genes that also set us up to want to drink more. We are drawn to it more than other people are. So, that creates this kind of perfect storm. And all you have to do is add something from the environment. But that's what confuses people, because still today people will say, what disease? They choose to take the drink. They choose to take the drug, right? And let's remember, alcohol is a drug too. But we differentiate the two just because that's how we stigmatize things differently in society. But we're drinking, and also, but to a lesser degree, we're also a drugging society. And it's not the choice of the drug, it's what happens once you put it in your body. And one of the things that really help people understand is if you yourself or somebody who has allergies, you understand this. My husband, for instance, has terrible hay fever. And in the summer, we can be out, we're breathing the exact same air. I am perfectly fine, but his eyes are watering, he's sneezing, he's having a terrifically different experience from breathing in that air. Or we know it with people who eat shellfish, or the kids that just have to eat a peanut and it's fatal immediately. So it's not just alcohol and other drugs that do this. There are other things in our environment that when some people add it into their body, they have a different experience.
With this knowledge, Debra, what do the children of an addict need to worry about?
Well, and I am a child of an alcoholic, so I understand this very well. There isn't a test. We don't have a test. We can't go in and get a test that says to us, oh, yes, you are at risk for alcoholism. So every child of an alcoholic or an addict, they have genetically, we know now, a 50-50 chance of being genetically wired for addiction. That's nothing more than a toss of a coin. And what happens in our brains and the way we think so often is, oh, I'll never let what happened to mom, or I'll never let what happened to dad happen to me. I'm going to watch my drinking. And I always say to people, what do you think you're going to see? Because by the time you see symptoms of addiction, you already are addicted. Just like diabetes. It's a quiet, silent disease until it progresses to a certain point where you see the symptoms. And now you're already there. So I think anybody that was born into a family that suffers from addiction has to look at themselves very, very honestly and make a decision. For myself, I made the decision when I understood it was genetic not to drink or take any other mood-altering drugs. And that was 25 years ago because I realized, oh my gosh, I'm looking around at my family and I'm like the only one who at that point wasn't addicted. And I thought, if I continue to drink, it's playing Russian roulette. When is the bullet going to, hit the brain? When is the addiction going to be awakened in me? So as long as I never drink or take a mood-altering drug, I'm not going to know, am I wired or not? And frankly, I don't want to find out the hard way.
So, Debra, an addict goes through a program and now comes back and is reentering society and family relationships. What is the role of the family at this point? What is structured family recovery, and how can family members heal and aid the addict in healing?
This is what gets really interesting about treatment. We know that after treatment, when somebody leaves treatment, 50 to 90% of those people relapse in the first year. Those numbers are enormous. And the cost of family is huge. I don't even have to talk about that. I mean, it's not just the money. Anybody that knows addiction in their own family or somebody close to them, they know how it tears apart at the fabric of the family. With structured family recovery, and in, my newest book, It Takes a Family, this is something that says to families, wait a minute, you don't have to be on the sideline anymore. We're going to get you right into the game. Because in the past, families have really been relegated to non-involvement, but they're the most important people. This is the key, and this is what works, because guess what? There is a winner's circle, and they're doctors. Doctors, they engage in a very specific program they're required to after treatment. And 96% of doctors have zero relapse in the first year. Zero relapse. In 5 years, 78% have no relapse. So It Takes a Family and this concept of structured family recovery, what I have done is I have taken the principles that work so well for doctors, and let me make a point, because a lot of people out there are thinking, of course they don't relapse, they're doctors, they know better. That is not the case. Doctors are at much higher risk for relapse than the general public, much higher, and they make terrible patients. But what I've done is what works so well for them is I've transformed it into something that works really well for families. What we do is we take a family and we transform them into a recovery team, and we keep it simple, because simple creates change. If it's complex, if it's hard, we won't do it for long. And it's all centered around a weekly meeting that happens on a conference call so that you can be anywhere. You can be on vacation, you can be at the kids' soccer game, you can be in bed in your pajamas, whatever. You can make this 1 hour a week. And then we get everybody in the family involved in 12-step family recovery. Again, simple. Another, for the family members, another 1 hour commitment a week. And the thing about it is, Joan, is that the relapse rate plummets when families do this. And in the book, we give the family, we choreograph an entire year. You don't have to think about what you need to do. We make it really easy.
The book, again, is It Takes a Family, A Cooperative Approach to Lasting Sobriety by Debra Jay. If you'd like to get more information about the book, Debra's work, or the topic of addiction, you can visit her website, lovefirst.net. Debra, thank you so much for joining us today. I actually wish we had more time because I think this is such an important topic. And I think the information that you provided can really change not only the life of the addict, but everyone around that person. And I'm very grateful that you were here to share this with us today.
Thanks for inviting me, because it's really been, enjoyable to be with you, and maybe we can talk again sometime.
We'll be right back. Hi, this is Joan Herman, host of Change Your Attitude, Change Your Life. Did you know that Change Your Attitude, Change Your Life has a free monthly digital magazine that can be read online or emailed to your inbox? Every month, nationally recognized leaders in their field provide information to educate, inspire, and motivate you. We believe in a holistic approach to life, incorporating mind, body, and spirit. Check out a copy of Change Your Attitude, Change Your Life 24/7. Visit cyacyl.com and be sure to tell your friends. Thank you for joining us today. We hope you found the show informative. At Change Your Attitude, Change Your Life, we believe that knowledge is power. Take what you've learned, apply it, and live your best life now. Remember that the information provided are the opinions of our guests and should never replace the advice of a professional who knows your personal situation. If you'd like more information, visit our website, cyacyl.com. That stands for Change Your Attitude, Change Your Life. While on the site, listen to past shows on demand, read the digital magazine, take part in the book club, and be sure to follow the show on Facebook and Twitter. Until next time, this is Joan Herman. Thanks for tuning in.